Hi, nice to meet you.
C'est Ashley. Bonjour, Fabien.
I'm Rhonda.
Ashley, bonjour, Fabien.
Bonjour.
Bonjour, Ashley. Fabien. Enchanté. It's going up. Vous voulez répondre? Est-ce que vous diriez que je lis ça en français ou en anglais?
English, please.
Yeah. So, each team has 24 minutes to present its case to the judge. The time of the presentation will be divided. The first 12 minutes of the presentation are considered as being protected, meaning that the judges cannot interrupt the team. The next 10 minutes are not protected. The beginning of this period will be when I ring this bell. When the non-protected period will end, I will ring it again. The judges have the possibility of interrupting the presentation in order to ask questions of clarification on the subject present at the moment. The judge will have no limit himself to the judge will have to limit himself to 15 seconds to ask his question. The team has to answer the question, but can then continue its presentation without waiting for the agreement of the judge. The judge cannot ask questions on a subject having already been covered or which has not been presented yet. This question must be approached during the period of question at the end of the presentation. The last 2 minutes of the presentation are meant to conclude the presentation and are shielded from question of the judge. I will show board showing the remaining time when there will be 12 minutes, 7 minutes, 2 minutes and 30 seconds left, and will make the countdown of the last 10 seconds by using my hand. A period of question of a maximum duration of 5 minutes is assigned to the jury at the end of the presentation. I would like to remind to each judge that it's mandatory to ask at least one question during this period. I will now invite the judges to introduce themselves.
Bonjour, good afternoon. My name is Fabien Paquet and I'm the General Manager of Pfizer Vaccines. Bonne chance.
Bonjour, bonne chance. Ashley Coughlin, I'm the National Business Director of Pfizer Vaccines.
Hi, I'm Cynthia Dulo, Commercial Director for the Oncology Business Unit.
Good afternoon, I'm Rhonda O'Gallagher, and I'm Vice President of Corporate Affairs. Good luck.
Good afternoon, Stella Hernandez. I'm the Business Unit Lead for Inflammation and Immunology.
Are we ready?
Pfizer has a rich history, and since the company foundation, Pfizer has contributed tremendously to improving the health of across the world. And we still see Pfizer having a great impact in the world if they can be known to be the future of the pharmaceutical industry. Membres du comité, permettez-moi de me présenter, ainsi que mon équipe, Florence et Rodrigo, ainsi que moi-même Félix. Il nous fera plaisir de répondre à vos questions en français ou en anglais à travers la présentation. I will not continue in English, but I'll keep my French accent. Today we're here to develop a strategic and tactical recommendation that will enhance Pfizer's reputation, sales, and relationship with all key stakeholders in the next within 5 years. The key question and issue that we want to address today are the following. First, the stringent regulation in which Pfizer has to operate. So how can Pfizer ensure that employees abide by regulation to maintain its reputation? The negative industry perception. So how can Pfizer change the light in which the pharmaceutical industry is seen at the moment? And lastly, the stakeholder communication. How can Pfizer maintain efficient communication with key stakeholders throughout the industry? Today, our recommendation is better Pfizer. We want to make the best choice and the right choice. The strategy breakdown is to restructure your organization in order to become an ethical leader in the pharmaceutical industry. We want to do this by a three-pronged approach. First is to add the Chief Value Officer to the core of the company. Install change from top down with an ethical leader in charge of this program. The marketing restructuring, pushing new message in more relevant channels for consumer. And also a new HCP or healthcare professional platform, created an integrated platform for healthcare professional to provide new benefit from that. I'll now pass it on to Florence, who will go for the insight of a recommendation.
So if we look at what's going on in the industry right now, we see that there's a bit of a misconception of the pharmaceutical industry as a whole. So according to a study that we saw from Forbes, the problem really lies into that the customer feels that the pricing is unfair and that there's a lack of transparency with management, and we're going to address all of this in our recommendation today. So if we look at the three main ethical concerns that we saw for Pfizer, first of all, the advertising scandals that are going on in the pharmaceutical industry as a whole. So we know that there are really strict regulations for advertising with the PAAB regulations that we need to follow. So there's a bunch of different rules for direct to consumer and also for marketing to healthcare professionals that needs to be followed. And some employee actions can really impact the reputation of the company if they act unethically and can really affect your brand perception. The second thing is the high retail prices. So we saw that a few scandals also happened in the past where the prices of medicine has been raised. And the problem here is that the customer doesn't understand what they're paying for, and they're actually paying for the R&D, and that's why they don't, that really tarnishes the brand because they prefer going for generic medication and they don't understand. So that's really just a lack of knowledge here. And for the third one, it is unethical relationship with healthcare professionals. So some of the relationships can be viewed as a bit biased, as some of the healthcare professionals are brought to retreats or sponsored meetings, and that can really affect their judgment. And we really want to ensure that the tone at the top is really ethically correct, so that all of that is brought down all the way down to the consumer. So here the key takeaway is that we need to enhance the relationship between the top management and the employees to really make sure that the culture of the company relies on ethical behavior and to really bring back up the image of the pharmaceutical industry as a whole. So now if we look at your competition, so here is a graph we found that ranks all the pharmaceutical companies according to their customer perception. So we see here that Pfizer is ranked as the 5th one, but we see that there's a gap between really what your values, what you really stand for, and how people perceive you. So we know that you stand for trust, quality, reliability, and you're extremely patient-focused. And your center vision is really to make the customer feel good and to make him feel healthy. And so we see that this gap stems from really a lack of knowledge from the customer, and they are just afraid that the information is misleading and that there's a lack of transparency in the industry as a whole. So we're really going to address that further on with Rodrigo and the implementation. So if we look at your key stakeholders here, so first of all, we took a look at healthcare professionals and insurance companies. So those are really educated from pharmaceutical companies, and there's a lot of educational material that you guys provide to them. And they really determine what the customer can purchase. So healthcare professionals give the prescription out to the customer, and then they go buy out their medicine. And insurance companies, by giving reimbursement, also control what the customer is going to want to purchase, depending on the price and what they're able to reimburse. And we found that healthcare professionals are becoming increasingly busy, and we think that this is an opportunity for you to be able to help them by developing a platform with educational material or medication services or clinical trial information where it would really facilitate their lives and their jobs and that's Rodrigo's going to go into that also further on in the implementation. If we look at your second key stakeholder here is the general public. So they're really afraid, as I said, that the information might be misleading, that there's a lack of transparency, that the pricing is unfair, or that the management integrity is a bit biased. But if we look at this study that we found from the U.S. National Library of Medicine, we found that right now, as of right now, 34% of the patients have a favorable image of Pfizer. But if these patients are involved in the clinical trial, this number raises to 68%. So that means that when the patient is informed, they are able to really increase their brand perception. So we really want to make sure that we educate the patients about the R&D process and that they can see the benefits of all these research and all these funds invested in R&D and to really change their perception. So just to sum up all the insights that I just said, so if by implementing our recommendation today, you're going to be able to see these 4 benefits. So first of all, it's going to be really more easy to hire. So by projecting a great brand image, you're going to have more facility to attract top talents. For sales, also, since the customer is going to be more trusting and understand more your pricing points, you're going to be able to also increase your sales that way. The investors are also going to be more attracted by these ethical behaviors and more willing to invest. And the government will also be able to support you better as you're going to become the leader, the ethical leader in the pharmaceutical industry. I'll now pass it on to Felix for a quick financial snapshot.
So what we want to do is here just grasp where you are in order to move and make the next direction, in the next direction. So some financial metrics, some key financial metric that we want to look at is your operating margin and your RORC, so your return on research capital, that we found out are really key metrics in the pharmaceutical industry. So right now, operating margin are almost 16%, and the return on research capital is almost on 1 or 94%. Your revenue are at $53 billion, and you have cash on hand of $2.6 billion, and an interest coverage ratio of 7 times, which puts you in a great financial position to take the next step in the right direction. So what we want to do now is I'll pass it on to Rodrigo. He'll go a bit more about our implementation of the strategy.
So before we actually decide anything, one thing that we absolutely had to answer was whether or not becoming an ethical leader was worth it. So we understand that there are a lot of players in this industry and not everyone is abiding to ethical standards, and that's because some people are, and so we don't necessarily have to go there right away. So we actually came up with 2 alternatives here. One, which was to become an ethical leader and invest a significant portion of revenue in organizational restructure and our whole strategy. And the other was to instead repurpose that money for focus on research and development, which could be used for further products. Now we benchmarked both of these alternatives against each other with 3 decision criteria. So the first, compliance, whether or not these actually respected the laws and regulations in Canada. The second was brand perception, so whether or not you would gain a positive image from all of your different stakeholders. And the third was the sustainability of the revenue that would be gained from our alternatives. So if we actually go to our next slide, what we see here is our decision matrix, which is a bit of a framework that we use to benchmark them against one another. And we actually rate them from 1 to 3, with the exception of compliance, which was our key decision criteria, for the fact that it would allow us to abide by, affect the brand perception that we have with our consumers. So what we see here is that with the key decision criteria of compliance, our clear choice is to become an ethical leader, and that we see that the sustainability of the revenue that comes from investing in R&D won't necessarily last into the long term. With that being said, we are very proud to pronounce you exactly what the doctor ordered, better Pfizer. So making the best choices and making the right choices. So our strategy breakdown here is that we're going to restructure your organization a little bit in order to become an ethical leader in the pharmaceutical industry. And we're going to be doing that with the help of our 3-pronged approach here, which includes a restructuring, which includes a chief value officer, which includes a restructuring of your marketing, your message, and the channels that you use to communicate with your key stakeholders. And the third is an innovative HCP platform, which will allow you to communicate better with healthcare professionals and with consumers. So if we take a look at today's prescription, we actually prescribed it in 3 doses. So we have our short term here, which happens from year 0 to 1, which actually has a very clear goal of restructuring the organization. So this is where we're going to hire our Chief Value Officer. It's also where we're going to start affecting change within your organization. So making sure that everyone abides by these new standards. We have our marketing developer for the future messages that we're going to be portraying outside. And we're actually going to be developing our platform for healthcare professionals in this dose. So in our second dose, years 1 to 3, our main goal here is to communicate with all our stakeholders. So that, of course, happens with a press release where we're going to be very excited to tell everyone just how committed we are to ethical standards and being ethical leaders within this industry. Now, we have already affected the change that is within our organization, so it's really important to reinforce that change and make sure everyone's very aware of exactly what ethical standards need to be abided by, and we'll also be learning from our employees to make sure that we know what went right and what went wrong. Now, we're also going to have our Better Pfizer marketing campaign that is going to extend into the long term. And we're going to be opening our conversation with our consumers in order to facilitate communication between consumers, healthcare professionals, and ourselves. Finally, we're also going to be trying to increase the platform adoption rate once our HCP platform has been completely developed to make sure that we can really optimize in the third dose, which is from the years 3 to 5. Where here we'll be gathering insights from the platform that our healthcare professionals have been using and that our consumers have been communicating through. And we'll be able to analyze this data that comes through this platform to actually provide insights to insurers, provincial governments, and all other stakeholders. Now, what all this terminates in are 3 wonderful KPIs: an operating margin of nearly 20%, a return on research capital of 1.28, and a perception increase to nearly 50% of a favorable perception for Pfizer.
Can I ask you a question?
Absolutely.
Can you go back one?
Sure.
Tell me a bit more about what you would put in your insurer's insights bucket.
So this is something where you can see exactly what type of information healthcare professionals are looking for and what type of medication they're looking at. And that would be the type of thing that insurers would then be able to see in order to planify budgets in terms of what they're going to be reimbursing and in terms of what's most popular with healthcare professionals and what they're prescribing.
Okay.
So may I ask a question as well?
Absolutely.
How did you come to
On the same slide.
So switch slides and ask.
I'll save it for later.
So what exactly is a Chief Value Officer? So a Chief Value Officer is someone who first creates an ethical framework by which the company must abide, and then enforces the ethical framework throughout the organization. So we actually found an article from Deloitte, which is called Help Wanted Chief Value Officer, which is about the pharmaceutical industry. And they said that the best background for this type of position is someone who has a bit of a business background, but mostly background in medical ethics, and that generally speaking, younger people might be better for this position. Hey, tip. The other important thing to realize is that they absolutely have to have a constant communication with the Chief Executive Officer for all strategic decisions, which we'll get into in just a little bit. So some of the change management tactics that we're going to be including within the company are a whistleblowing policy for unethical behavior that could reach at any level of the organization. We're going to have regular training and ethical simulations for learning with all members within the organization, and we're going to be reinforcing these changes with regular quizzes and tests with employees to make sure that they really understand what's right and what's wrong. So what does the organizational structure look like with our CVO? So we understand that every strategic decision must be made with values and ethics in mind, but we also understand that the company needs to make money. So that's why our strategic decisions are all approved by the CEO, the CFO, and the CDO. And then collectively, all of the other officers will be giving insights and deciding on high-level decisions together. What this means is that we're making sure that every decision that we take as a company is abiding to ethical standards that should be respected by the industry as a whole. Now, let's talk a little bit about our healthcare professional platform and how it's going to be adding value to their lives. So what we understand is that by providing information to them, we're actually facilitating their workload, which is very busy, we understand these days. And it's actually adding a non-tangible benefit, so it's something that is more ethical than perhaps bringing them to a retreat or to a sponsored meeting. So we'd like to introduce you to Pfizer Professional, your new healthcare professional platform. And what we're going to be featuring is information that we saw they were most inclined into learning and that usually they just look up on their own online. So what we're going to be doing is gathering all of these insights together in one easy-to-use platform, which they'll be able to consult regularly whenever they're discussing with clients. So some of the things that they can see is prescription guidelines, case studies with Pfizer products, key opinion leader videos, symptoms and diagnostics for treating patients. They can also have discussion forums with other key healthcare professionals within the industry. as well as in-depth clinical trials that they'll be able to have access to information of. Finally, if ever they have questions or of how they should be operating with their service, they'll have consulting groups there to help them as well. So with all this being made, we actually need to see how selling and general admin expenses are going to change. So one thing that we're recommending that you do is that you divest from direct consumer advertising to reduce your marketing expense. This is something that we've seen as a first mover in the industry because we see that TV advertising often does more harm than it does good. When you see TV advertising, it has a long list of side effects and potentially scary symptoms that could come from taking a product. It doesn't exactly help, and these are things that have to be there because of government regulations. So we're going to be divesting from this, and we're going to be reinvesting in new marketing investments. So the first one that we have here is something that we like to call PfizerTrials.com. This was heavily inherited from something that GSK is actually already doing. They opened their clinical trials and all the data that is related to them to the public, and that they actually offer real-time data for clinical trials to show those test results and to prove that they're not being falsified to consumers. Now, I just want to take a second to say that this is not the same data that will be shown to healthcare professionals. Well, it is the same data, but it will be giving a more extensive look to healthcare professionals that is more relevant to them in the end game. Second, we'd like to create a social media response team because we understand that consumers actually do consume a lot of information online now, and it's on social media. And so we want to create this task force to answer false news that is being spread by the media or potentially by consumers with factual evidence to refute them right away before they spread and make bad company image for you. Finally, we're going to be updating your brand messaging to showcase the accomplishments of you and the pharmaceutical industry as a whole, which we'll go into right now. So when creating this new message strategy, we actually have to ask ourselves, what is behind Pfizer and what has made your company so great? So we're actually creating a new message for the general public and patients as well as patient groups. And that message is that the pharmaceutical industry has saved millions and millions of lives, and it has enhanced millions and millions of lives. And so we've actually created that collectively through one key slogan, which is Better Pfizer, Better Tomorrow. So this is going to be a message that you're going to want to push through key channels that you're already using, but we really want to make sure that we have these three themes within this messaging. So the first is science, because we understand that consumers actually respond very well to efforts and accomplishments that are related to science, and they really need to understand that R&D isn't just an expense on your balance sheet, it's actually the collective work of many, many people putting in sleepless hours just to help lives. The second one is patient groups. So here we want to focus on the lives of the people that are currently changing because they're going through a certain disease or because they're going through a certain ability that is striking them, and exactly how it's being changed while we discover new medicines. So while research and development expenses are occurring, these people actually are going under therapeutic treatments as well, and we want to showcase these people to show that we're helping them in that respect. Finally, we also want to demonstrate the therapy that patients go through every day with disease awareness. So we want to make sure that people are aware of the different types of diseases that don't have actual medicine for them yet. A great opportunity, we could have seen something like a collaboration between Pfizer and the ALS Ice Bucket Challenge. We really want to put forward our best foot forward and try and collaborate with patient groups as much as we can to make sure that these types of successful philanthropic activities actually go through and go viral, because that's the end goal for everyone. So absolutely in any strategy there are risks and mitigations that need to be addressed. So one of them was that we potentially see an increase in countries that prefer generic medication. And so what we'd like to do in that case is increase the marketing effort in those regions to really showcase the efforts of and the importance of R&D. The second is that the competition does not invest in ethical behavior, and therefore will have a little bit more cash on hand than us. But we recommend that you maintain your ethical expenditures, as they are going to be giving you a competitive advantage. Third is that employees don't respond well to changes within your organization. And so in that case, we really want to make sure that we create more communications with them and we educate them on the benefits of this to the company, to the employees, and to society. With that being said, I'd like to pass the floor to Felix, who will go over the financial impacts.
So this great recommendation that we have for you here today, we want to break it down in a budget for planning this next venture that we want to take. So our marketing campaign or our marketing approach will be will be the main chunk of our budget for this implementation. We're talking of a budget of $500 million, sorry, and our HR program will be 130 million of the 500 million. What's really interesting is that the HR program and the IT implementation are a one-time investment that you'll only need to do one and they're not recurring, but the marketing campaign will be recurring each year as marketing needs to be pushed throughout. What we want to do here is that we took the base growth, the expected growth rate for the industry, and we took it and to apply it to the financial of Pfizer. So in light blue, we can see that if we don't change anything and we just go with the flow and innovate as you've been doing, we see a sustainable growth that should be somewhere around 2 to 2.5%. But what we decided to do is that by investing $500 million and by changing the culture and the perception and the way Pfizer do its business, we see a little drop in the first year in the EBIT, or earning before interest tax, but after that our investment into or a new venture or a new approach will generate a growth of around 3.6% for your EBIT line, and will generate your operating margin to reach almost 20%, which is one of the key metrics that we identified earlier today. Also, your return on research capital or return on research and development will increase from 0.94 to 1.28, which is also a major financial metric that we want to look at. And your coverage ratio will pass from 7 times to 7.4 times, meaning that you'll still be in a really good financial position in the future. Meanwhile, all of these good news will generate an increase in revenue of almost $9 billion, pushing your revenue to $62 billion. Today, we address 3 key questions that we identified at first. First, how to work with the stringent regulation, the negative industry perception, and the stakeholder communication. So how do we want to merge all of these together? It's by outlining some of the key issues. So the education gap, the lack of knowledge, and the misconception. We'll address all of these 3 by the marketing educational campaign that we want to do in order to spread the word, making sure that people understand what's going on with the new Pfizer. After that, the outdated views and the fake news are something that we really want to address by the reorganization of the corporate structure, and also by the PR team, making sure that the message that we broadcast out there is clear, understand, and it's in line with the new Chief Value Officer proposition. Lack of feedback, media consumption, the platform will really address these issues. This was a presentation for the Pfizer recommendation. Thank you very much. I'll now open the floor for questions.
So in the campaign, you said there's the marketing reputation campaign. What would be the balance between, say, talking about, say, writing the wrong, outward misperceptions here, versus talking about product? What would be the balance, you would say, on?
So I think that we think that the most important thing here is not so much to talk about product, but more solutions, and that is actually a melding of both of those things together, and how the products affect the people's lives moving forward, and how they are also righting the wrongs of the past, and the fact that they're being developed.
I have a follow-up question to that. Thank you for your presentation, by the way. So have you given any thought to what channels you would use for that type of communication, that campaign? Because I mean, I know you did say, reduce the amount of spend on DTC, television. Those are specifically for brands. This is a campaign around reputation. So did you think about what channels you would use?
So just in terms of channels, we do understand that some of them are heavily regulated in terms of the pharmaceutical industry, and so we didn't necessarily focus that part of our strategy on looking into what is possible and what isn't. But some new channels that you can look at are social media. We understand that Pfizer actually has a very large following that a lot of people are into, as well as the individual brand pages that are new types of media that can be leveraged in the future.
Okay, thank you.
I have a question, maybe more for Felix, around the financial impact. I mean, very impressive, $62 billion. I mean, who wouldn't want that? Can you explain to me what the primary driver or what variable is driving that growth?
The primary driver will be that throughout our clinical trial and throughout the breakdown of our strategy, so throughout the breakdown, the main driver, the main growth will be that by bringing the message of the value of ethics and also by bringing your client with the trial in, we saw that brand perception can really increase dramatically, and so by combining these two, that's where the growth will come from. So instead of having the growth of 2.5% that is expected from the industry, we're more expecting that 3.5, 3.6% by combining the marketing and the new value proposition.
Congratulations, well done. Very provocative and innovative presentations. And I learned a lot actually. The return on research capital. I need to speak with my finance partner to know what is the case for us. My question is related to the fact that you have looked at this from a wider perspective than the case was designed to. What did you learn from Pfizer when you read this and when you prepared for that you didn't know before?
So I'm not sure we completely understand your question. Are you talking about what we learned from the case?
You get the case and you did a fair amount of research outside of the case because what you've presented was data outside of it. What did you learn that you didn't know about Pfizer before?
We've actually learned that they're among the ethical leaders already. They are doing a lot very well, and it's just that this pharmaceutical industry needs this last push in order to really make the jump from where they are right now. If we could actually go through this. We saw that this is one of the biggest issues that's facing pharmaceuticals as a whole, and that it's one of the key points that needs to be addressed moving forward.
Okay. Thanks.
Thank
Well
you so
done.
much. Very
Very good.
Yeah.
good.